Hi, I'm Brittany Pike. Today's case analysis is going to be about AA. He's a 10-year-old male. Obviously, he's unmarried and no occupational status at this time. He does have both mom and dad at bedside. AA's only past medical history is significant for Ewing sarcoma beginning in 2012. Family denies any significant medical history other than that and denies taking daily medication. They also deny significant family medical history, and his only allergy is to topical chlorhexidine. AA's primary tumor was diagnosed in his right shoulder in 2012. So at that time, he had surgical excision of the primary tumor, radiation, and chemotherapy. In 2015, AA had a recurrence of Ewing sarcoma with a tumor found in his brain after complaints of persistent headaches. Treatment in 2014 include tumor excision, radiation, and chemotherapy. So beginning in 2018, the patient had a recurrence of persistent headaches. They were intractable to pain medication and received a CT scan which revealed a sarcoma in the right parietal region. After a 24-hour, so he had came in for a 24-hour pre-op scan just to get some imaging done of the tumor. At that time, they were concerned about the tumor growth and the brain involvement of the tumor. And he was supposed to go home, but he was admitted to the pediatric ICU at that time for 1-hour neuro checks until his surgery the following day. So assessment of the patient, neurologically, the patient is an EMV of 15. Pupils are 3, equal, round, and reactive bilaterally. The right arm and shoulder weakness, he does have right arm and shoulder weakness and limited ability. It's related to his prior sarcoma in that shoulder. Patient also exhibits right-sided blindness and deafness related to his brain tumor and subsequent treatment in 2015. He does have complaints of persistent headache, localized to the right side with a pain of 5 out of 10. Pain medication has shown to have no relief. He is neurologically appropriate for a 10-year-old. Respiratory, patient is on room air with oxygen saturations greater than 92%. His respirations are even and unlabored with a normal rate. Lung sounds are clear bilaterally throughout all fields. Cardiovascular, patient's heart rate is in the 70s to 90s. Normal sinus rhythm, no extra heart sounds noted. His temp is 98.3 at this time. Pulses are 2+ on all extremities. Brisk cap refill. He is pale, which is baseline per mom and dad. His MAPs are in the 70s at this time. GIGU, patient is tolerating a regular diet. Bowel sounds are active. No pain or tenderness noted. Last bowel movement per mom was the day prior to admission. He is voiding painlessly, and his urine output is greater than 1 ml per kilo per hour at this time. Ewing sarcoma is a cancerous tumor that occurs in bones or soft tissue. It is typically found in the long bones of the extremities. Less than 5% of brain metastases, such as AA's, occur because of bone or soft tissue sarcomas. The incidence of Ewing sarcoma is about 250 cases are newly diagnosed each year in the U.S. Around half of all of these cases are diagnosed between the ages of 10 to 20. So it's generally considered a rare pediatric sarcoma cancer. In white people, actually, Ewing sarcoma has an incidence rate at 9 times that of African Americans. So while AA was diagnosed at age 4, he fits into both of the latter categories, being a white male child. The most common symptom of Ewing sarcoma is pain at the site of the tumor, which AA exhibited. Other signs and symptoms are often bone-related, such as bone fractures at the site. A mass may also be felt under the skin at the site of the tumor. Because the relapsed tumor occurred in AA's brain, there were no signs and symptoms that may be associated with tumor growth within bones. Sometimes patients have come in with fractures as their initial complaint just because the mass has grown to a large number and weakened the bone at that site so that it fractures. And occasionally you can feel a mass at the site and swelling as well. Patients, particularly in cases involving metastasis, may also exhibit a fever and decreased PO intake. AA exhibited neither of those symptoms when he was here with us. When Ewing sarcoma presents, several tests are performed for the definitive diagnosis, or the initial diagnosis. And in sarcomas arising in the long bone, X-ray is typically the first test that is done. If the x-ray shows a mass, a CT scan and bone scan are done for further imaging and staging of that tumor. A definitive diagnosis of Ewing's tumor is made by a biopsy of the mass. Because AA's tumor did not reoccur in the bone, a CT was the first imaging done, and with biopsy to be performed in the OR at the time of his resection. Treatment of Ewing sarcoma typically involves alternating 2 different chemotherapy regimens over the course of 9 to 12 months after the initial removal of the tumor. Radiation therapy is often used in conjunction with chemotherapy, as AA has done in the past. AA began his initial treatment in my unit with the tumor resection, and then was discharged to the oncology unit within 24 hours of that surgery. His continued treatment plan had not been decided upon his discharge to the oncology unit, but the initial discussion was that it was probably going to involve 12 to 13 months of alternating chemotherapy drugs with radiation, and he had obviously already had the resection done at that time. As far as prognosis, when a patient has a localized sarcoma, the long-term prognosis is around 70% survival rate at 5 years. In patients who have metastasis involved, at diagnosis, 15 to 30% is the 5-year survival prognosis. So I visited my patient on the oncology unit a day after he was discharged from my PICU. He was in great spirits. He's just the sweetest. He was tolerating his food well. I went and visited him at dinner time, and he was eating fine. And he was really, his pain was well under control at this time from the surgery site, and he was just waiting to be discharged home for outpatient chemotherapy at this time. Thank you.